All right, welcome back, everyone. We're going to continue our lecture on the neurological exam, and this is going to cover the mental status exam. And so the abilities that are assessed through the mental status exam can be separated into four groups. So I'll list them for you, and then we'll get into each of them individually. The first is orientation and memory. Then we've got language and speech, sensorium and judgment, and lastly, abstract reasoning. And each of these four are also going to correspond with particular areas in your central nervous system, and particularly areas within the brain. And so we'll talk about what areas those are as we continue. We talk about orientation and memory. Orientation is more or less the patient's awareness of your immediate circumstances. And it's awareness of time, not in terms of, is it 12 a.m., is it 12 p.m., but more like what date is it, what month, what year, things like that. It's an awareness of the place. Do you know where you are? You're in the hospital, right? You're in the doctor's office. Where are you? It's about personal identity and being able to relate to the examiner. So who are you? Who are your parents? Things like that. What's your name? What's the date? Who's the president? These are questions that an examiner will use right off the bat when beginning the neurological exam. The next will be things to assess memory, like small memory tasks. A patient might be asked to remember 3 words: book, puppy, and coin. And then you continue on a conversation with them. 30 seconds, a minute later, you say, what were those 3 words that I asked you? And if the patient is to respond, book, puppy, and coin, that would be passing. If they can't remember it, then you know something's up with memory. You might also ask a patient to recite the months backwards or spell something backwards. And you do that in order to avoid any learned patterns where you're almost not thinking at that point, you're not recalling, or it's just a pattern where you remember it differently than you would to have to recall, which is slightly different. When we talk about memory, if you remember, it's largely a function of the temporal lobe and structures that are beneath the cerebral cortex, like the hippocampus and amygdala. So any deficiencies that you might have, or the patient might have in these tests, might point to trouble in these areas. One interesting case study is this guy right here. They called him patient HM, and Henry was basically, he was an epileptic, and though the epilepsy they figured out was localized to both of his medial temporal lobes, and so in 1953 he had a bilateral lobectomy, which is basically they cut out those lobes of the brain. And it alleviated his epilepsy, but what it resulted in as a side effect was the inability for Henry to form new memories. And that's a condition called anterograde amnesia. Now, interestingly enough, he was able to remember things that happened before his surgery, but he did have a partial loss of the earlier memories. And if you have loss of earlier memories, that's called retrograde amnesia. So anterograde is after amnesia, and retrograde is before amnesia. And so basically, this guy became a case study of how the brain interprets memories and stores them. So he did retain his short-term memory and things like procedural memory, like riding a bike and driving a car, but he lost his ability to form long-term memories. He would be able to remember things for about 30 seconds. So if you gave him the 3-word task that we talked about before, he would be able to do it, but after a very brief amount of time, those memories would dissipate, and he wouldn't be able to store them in his long-term memory because the medial temporal lobe structures were removed. So basically, this case study points to the difference in our short-term, procedural, and episodic memories, and suggests that they are different parts of the brain. And so it's just an interesting case study, and I suggest you, if you're really interested in this, to read much more about Henry's life, because it's really, really interesting. The next part is language and speech. And there's two different subsets of this test that will address language. One will measure the ability of the patient to understand language by asking them to follow some instructions, like touch your right finger to your left elbow and then to your knee. And so these are things that you take in, you hear language, you have to interpret them, and then be able to interpret and also make yourself do the actions that you want to do. So it's testing a lot of abilities right there. And another subset assesses the fluency and coherency of language by having the patient generate descriptions of the objects or scenes like depicted in a painting or a drawing, or reciting sentences back or explaining a written passage. If you have any loss of language capabilities, that's called aphasia. And there's a few different types of aphasia, and depending on what type you have different areas of the brain that could be affected. And so there's two areas, the Broca's area and the Wernicke's area. And so basically, both regions are originally described on the basis of the losses of speech and language, which we called aphasia. And the aphasia that's associated with Broca's area is known as expressive aphasia, which means that speech production is compromised. So you're really not going to be able to talk at all. That is often described as non-fluency because you'll lose the ability to say some words, or you'll have broken or stuttering, halting speech. You can also lose grammar capabilities. And then, when we talk about the aphasia that's associated with Wernicke's area, that's known as receptive aphasia, which you will still be able to talk, but you'll just basically lose all understanding of what's being produced, what's being said to you, and also really what you're saying. And that's sort of interesting because when you'll get patients that are recovering from a really severe cases of aphasia, they'll basically report not being able to understand what's said to them or even what they're saying themselves. But they're often just continually talking. They can't just not stop talking. They're kind of completely lost. And you might find aphasia as a side effect of stroke. One interesting example that I was familiar with is one of my acquaintances' family members suffered a stroke. They survived and recovered, but aphasia was a longer lasting symptom. And they would say things, it was very frustrating for them. They would say things like, instead of take out the trash, they say, oh, I have to take out the remote. And so that's a different type of aphasia where, it's the receptive aphasia where you're sort of losing content. And you can imagine that that's pretty frustrating, especially when you know what you're supposed to say. You can ask them, did you mean take out the trash? And they'll say yes, as the aphasia is starting to clear up. And so I think aphasia is a pretty interesting thing to look at. Sometimes you might get something called conduction aphasia, which is associated with damage to the connection between those two regions. And that's really a rare thing, but it's likely to present itself as an inability to be able to repeat spoken language. All right. And the last, a couple slides I want to get into talk about sensorium. The parts of the brain that are involved in the reception and interpretation of sensory stimuli are referred collectively as a sensorium. And that happens in your cerebral cortex, where both conscious and subconscious sensory information is brought in and made to be able to understand. And so conscious, like your visual, auditory, and gustatory, but also subconscious, like balance and being able to take in sense around you to be able to balance. That's not something that you're consciously aware of, but it's something that's happening all the time. There's two subsets of the test that will assess specific functions of each of those cortical areas. The first is called praxis, which is a practical exercise in which you ask the patient to perform a task completely on the basis of verbal description without demonstration from the examiner. So you just say, take your left hand, place it palm down. You don't show them, you just say it. And if they're able to do that, they'll pass. If they're not, then you know exactly where you need to look for damage. The second is gnosis, think like diagnosis, which involves two tasks. The first is stereognosis, which basically just involves you being able to understand what you're holding, basically identifying objects by their touch. For example, if I hand you a penny versus a quarter, you should be able to determine that one is a penny, one is a quarter, because we're all pretty familiar with what you're able to determine between maybe it's the size, the different textures, the roughness of the edges of the two different coins. The second is graphesthesia, and it's the ability to recognize numbers or letters that are written on the palm of your hand with like a pen cap. And so those are two different types of testing the senses that you can do in this test. The last section I want to talk about are the judgment and abstract reasoning parts. And that happens in your prefrontal cortex. It's responsible for the functions that are of planning and making decisions. And so in order to test that in the mental status exam, the subtest that assesses judgment and reasoning is directed at three aspects of frontal lobe function. The first is the examiner will ask a question about problem solving, such as, if you see a house on fire, what would you do? And there's a number of things that you have to do in your brain in order to be able to see a problem and then lay out a plan to solve that problem. The patient might also be asked to interpret common proverbs such as "don't look a gift horse in the mouth." By the way, if you don't know what that one means, it basically means don't find a fault in a gift. Okay, so basically if somebody gives you a gift, don't immediately look for the wrong in it, just accept that you got a gift. I actually didn't know what that would look, so maybe I would fail the part of this test. But now you know, and now we both know, so we don't have to fail that. And then the last part, you might be given pairs of words and told to ask for similarities. Apple and orange, lamp and cabinet, things like that. Okay, so that's the mental part of the neurological exam, and we'll be back with the next part in the next video.